Thanks for stopping by. Today I'm all dolled up with a new hairstyle, new color, and some eyeliner. I'm not a makeup guru, but I put on a little bit. I'm at work and I'm doing a video on what I do in a day. I can't show you everything because of confidentiality purposes, but these are some of the things I do in a day at work. So please sit and watch while I work some of the things. So before I get into the video, I just want to share with you what I do. I am a dental assistant and I work in the oral and maxillofacial surgery. The oral and maxillofacial surgery is a type of dental specialty that deals specifically on the facial bones. The oral part of it includes surgical removal of the third molar or wisdom tooth, soft tissue biopsies, and hard tissue biopsies as well, lesions of the tongue, oral cancer, and so forth. The maxillofacial part of it includes fractures of the lower and upper jaw, cheekbone, the nasal bone, the orbit, TMJ dislocation, that's the area right at your ears. Also, craniofacial fractures. And not to forget, this is so TMI, we also do remove maggots from the oral cavity. We also deal with huge abscess of the face and removal of pathology, which includes ameloblastomas. Some persons, they have mandibular or maxillary torics located in their mouth. If it's too huge, then we remove those. They're normal growth of bone, but if they're too big, then we will remove those torics. So that is also included in the oral and maxillofacial surgery. There are so many other things that I cannot speak to you about in one video. There's other areas of the oral maxillofacial surgery that we do. I can't do everything in one video. So if I'm not too busy, again, another day I'll do another video going into more details about what really take place in the oral and maxillofacial surgery. So let's just get right into the video, guys. So let me start by sharing with you some of the areas in which we use plates and screws when there's a fracture. So as you can see, this is not a real skull, but these are the areas that we use pins and mesh and screws. Some of the areas that persons get fractured that we have to go to the main theater to fix. Does this look a little bit familiar, guys? Well, it is not braces. These are arch bars and wires with elastics. What this does is to fix the maxilla and the mandible together when there's a fracture. So this is called closed reduction or maxillomandibular fixation, not a braces. People mistaken it for braces. So I'm showing you now here the x-ray room that we use in this dental department. This here is a panoramic x-ray, and I'll show you how I use it in a next video, possibly. And this is the whole structure of it. You can do CT scans and panoramic x-ray, also cephalometric x-ray. This here on the wall is a smaller one, PA x-ray machine. It's a much smaller one. Whenever we're using the x-ray machine, we use these lead aprons to put over the patient. So to start off my morning, what I'll do is wash my hands. I didn't get a chance to video that part, but what I do, wash my hands, get my PPE ready, So I'm putting on my gown now. Then I'll put on my glove. So I'm going to just prepare the operatory for the first patient of the morning. There are seven operatories, and with the help of my colleague, there are quite a few of us that work in here, and each of us do our part into getting the first patient on the road. So that tank that I'm pointing at there is a nitrogen tank that we use for surgical extraction, and I'll show you that in another video how I attach it to the tank and how it is used. So I'm wiping the surfaces, and this is done after each patient, but the first thing that we do in the morning is to wipe down every operatory, every chair, every light. So I go to the surface first and then the light, and then I would wipe the chair. And so I have to get every part of the chair because people have to sit down in the chair for a good amount of period of time depending on the procedure. Then I discard my glove, change another glove when I'm putting out the syringes, the sutures, the instrument, all that we need in order to set up for the patient. So that's what I am doing now. I am setting out the smaller things that we need. Second operatory, cleaning, wiping down the chairs and the surface. So I'm using two different cotton to wipe it down, and this cotton is used with ibitane alcohol. I wipe the surface and then I wipe the chair. All 6 operatories are finished, and what I'm doing now is to write the persons that have an appointment for surgical extraction for the day. I will check the appointment cards to see who has surgical extraction, who has other appointments, and persons who are in for review, who came in before and are doing follow-up. So this is a patient who is here for surgical extractions. So after I see those persons who have surgical appointments, I would then ask them if they have an x-ray. If not, I will go ahead and do an x-ray. I'll also show you that in another video when I'm doing the x-rays. After I'm finished with the appointments, I'll go ahead and look at the referrals. These are persons who came in without an appointment, who have referrals for trauma, who have referrals for irreversible pulpitis, wisdom tooth extraction, pain, swelling. If you would like to see more of these videos with me at work, please share it in the comment below. Also, give this video a thumbs up, share, and subscribe to my channel. See you soon.